Meet Dr. April Jones. She's a social worker and so much more. She empowers, advocates, motivates, connects, educates, and encourages resilience. And she's at her best when addressing discrimination, oppression, and social injustice. So why would a doctor of psychology choose to do social work? After all, that degree can lead to a lucrative career. But then, money has never been April Jones' real motivation. She's happiest when she's facilitating positive social change. Let's find out how she got started on this path. April's career in social work started when she was just an undergraduate student at Stillman College. She volunteered to work with disadvantaged youth through the Big Brothers Big Sisters program. That just wasn't enough. She went to West Alabama AIDS Outreach to volunteer to get work experience. When she went in for an interview, the director offered her a part-time job instead. That was the beginning of April's macro social work career. She went on to obtain her master's in social work from the University of Alabama. While there, she obtained field placements with child welfare organizations and healthcare industries. During her time with a child welfare agency, she was able to find supporting evidence of child abuse of a client. That resulted in a new and safe home placement for the child. April applied her skill with color-coded genograms to trace the patient's history to support a mental health diagnosis. That resulted in reunification with the biological family after many years. Also, she was able to write grants and solicit donations from major corporations to obtain unmet needs of her clients. As an intern at a medical clinic, she was able to break down barriers to service by using her foreign language skills with Hispanic patients. These internship experiences equipped her to land her first postgraduate school job in social work. It was at a group home. She was a supervisor responsible for foster children. April worked long, hard hours to reunify families. She went on to work with governmental agencies in rare positions for social workers. She collaborated with Alabama juvenile court judges, giving them recommendations for services to establish for children in each county. Then, Hurricane Katrina struck. April worked as a voluntary agency liaison for disaster response and recovery. Her work served as a part of the government's model for lessons learned to improve disaster response and recovery. She later spent a decade of her social work career serving military families. She was a part of an expert team to develop programs and change processes. She was recognized for her ability to help reduce work hours and tasks to comply with the government position classification. She has received 6 challenge coins from various military departments, but more meaningful was when she was called a guardian angel by a colonel, who, by the way, is now a general. Her dedication to the profession continued with personal goals of addressing social injustices and workplace challenges in healthcare settings. She's published peer-reviewed journal articles and self-published books. She's traveled to several countries to present her research and books. Social work has taught Dr. April Jones to respect a person's dignity and worth. Today, her dream is to cultivate awareness and the importance of the profession through higher education. To empower the vulnerable and unrepresented populations of our society is her ultimate goal.